Everyone is fine too.
Alrighty, so let's go ahead and get started. I believe that Luke has the first point of our agenda today. You can provide us with a debrief of the trip, Luke?
I saw the Presidu's agenda, and I don't really know what else I can debrief about.
Just give us a little summary, Luke.
The trip went well. Yeah, the giving events went well. I think the school supply one was the most successful of us volunteers. Just because we were able to be most involved with it. We were involved a little bit with the Jollof feed, but we weren't able to do any of the cooking or anything like that. Yeah, I don't know.
I think that's good, Luke.
Okay.
What's next here? Warihana, please give us an update on grant opportunities for upcoming medical events. And then if you could also update us on the MasterCard Symposium.
Oh, okay. So the MasterCard Symposium was this month or last month. I can't even remember. But then it was a gathering, more like a conference for all MasterCard Scholar alums and some executives from the foundation and some of the partner schools, such as the University of Edinburgh, where I attended or I completed my master's degree. And basically, they just wanted to know what we've been up to. So they asked for a short slide deck on the things that we've been up to. So I shared with them a slide deck on the Northern Health Shield. And I also met two of my colleagues who currently work with the foundation, and I told them about the Northern Health Shield, and they told me they will be on the lookout for opportunities. And then sometimes they are even asked to recommend some organizations for certain opportunities. So if that should ever come up, they will recommend our project, the Northern Health Shield, for that. And I also met one of the executives from the World Bank, and she told me she'll introduce me to someone at Gavi. Gavi is one of the top players when it comes to vaccines. So overall, the symposium was a success. I met even more people, and then I told them about the foundation and then the work that we are doing. So our recent health event at Patanga revealed, should I say, a lot more positives with regards to Hep B than we expected. So we would be doing more of the health events. So I was asked to look for grant opportunities that we could explore for the health events. So be it vaccines, condoms, medication, etc. But since this is still in line with health, any opportunity that is related to health, it's something that we can explore. So I did some research on Friday and yesterday, and then I came across a couple of opportunities. The first one is a grant opportunity from the International Foundation Grant Program. And I believe we're a strong fit for this because it supports US based 501c nonprofits which give basic needs is, and they support programs in the global south that work in areas of health, community well-being, etc. But then the health is where we best fit in. So that's an opportunity that I would explore for us. Gavi, I would have to reach out to my contacts at the World Bank. The plan was when we launched the Health Shield, then she would connect me to her person at the World Bank. But I think now would be the best time. So I'll reach out to her to connect me to her contact at Gavi to see if um, there will be any form of opportunities with them that we can explore. But I strongly believe that Hep B testing and vaccinations would be a strong alignment with them because it's something that they are focusing on at the moment. So yeah, Gavi is another one. UNICEF as well for partnership, and there's a strong alignment with for the alignment that I see is maternal and child health, which we could integrate into the given event, the health given event. They also provide hygiene supports and then the wash, which is the borehole aspect that we will be doing. So every health event will come with a borehole, and the plan is to dig the boreholes at least 20 kilometers apart. Yeah. So there's this other organization called the WaterAid, and that as well is going to be in line with the wash. That's the borehole. There's World Health Organization itself, and um, here as well, I'm looking at exploring opportunities in line with the vaccines outreach, the screening programs, and disease prevention activities in underserved communities, which I know it's something that they're interested in. There's the ABAC Community Catalyst Grant, and we're strong fit due to give basic needs, hepatitis B awareness, testing, and vaccination, and the prevention interventions that we conduct in our community health outreaches. There's charity water for the water projects. There's UNFP for um, condoms, and then reproductive health education. But we could strongly explore the condoms aspect, because our last given event at Kwatanga, we distributed some condoms. There's the Global Fund, and there's a potential alignment due to the HIV testing and disease prevention and a broader public health outreach intervention. There is MSI reproductive choices, and I see a potential collaboration opportunity around. Um, I don't know if family planning is something that we could integrate some of this family planning medications, but with this particular organization, it will be in line with maternal health, reproductive health education, and family planning services. But that could be low priority one that we could look at. There's the Dana Foundation, and there's the potential opportunity for health related education, awareness, and community centered public health initiative. So this is a grant. There's Global Water Challenge, so water. Now, I also intend to explore some CSR opportunities with some of the big organizations in Ghana, such as Coca-Cola, MTN, and some other organizations. I have one of my formal teachers who is very well connected in the Ghanaian industry. So I've already spoken to him to connect me with some people that he knows at some of these organizations. I know he has strong connections at MTN, and MTN is the leading network provider in Ghana. So yeah, there are lots of opportunities out there that we can definitely explore. These are just the few that I found. I'm sure if I do more research, I should be able to find more. Yes.
Wonderful. That's all really great.
Thank you, Dan. Is it Daniel or Luke? I'm looking at my screen. Yeah,
This is Daniel.
Daniel. Okay. Thank you.
Of course. Salam, could you provide us an update on possible locations for the boreholes and future medical events? The first one's in the village of the chief that was going to donate that land, but I think there might be more.
Yes. So far, I have scouted a number of places, and I'm also looking at just like you might have seen on Discord, we are looking at how we can bring down the cost of the boreholes. So, and I'm also trying to see how we can bring down the cost per medical event to at least so we can do maybe 10 communities instead of 9 as the budget currently covers. And so we will do the first medical event and borehole in the community that provided us the land. The second one will be at Galway, which will be like the eastern part of the community that's providing us the land, about 50 to 60 kilometers apart. Though we agree that the lease should be 20 kilometers in between. That will be the least, but we can go as far as possible. So we'll do that. And the third community will be Nabuli, which is not too far, but still more than 20 kilometers away from the first community. And then the second will be Zinindo. The fourth will be Zinindo, which is closer to the Galway. That's the second borehole, but also more than 20 kilometers. And so these communities, we will do health events alongside boreholes. But in the event that, then the fifth will be Damdaboli, which is the second community that should have gotten the second health hub, because we had informed the community of our intentions. We had scouted some health professionals who will be engaging and asked them to apply for the health opportunity. So I think it is only fair that we do a medical event there. Fortunately, we already did a borehole in that community. So it means that we'll only do a medical event there and look around communities closer to Damdaboli Township where we do the medical event and offer them the borehole, because we have a borehole in the Damdaboli community already. And that would have been the fifth one. And then the sixth, we are looking at Naloao, which is also within the Gushegu municipality. And the seventh one, we are looking at a community called Kolgi. Kolgi, we haven't been there at all. It's also far to the west of the municipal, but a very deprived area that is not easily accessible. But I think that our services will be more needed there, because these are areas where when there are infectious diseases, they hardly would even notice because they don't have access at all to health facilities, and they don't have access to clean water as well. So we want to make sure that we are taking the services to the places that they are highly, highly needed and would be appreciated. And so that will be the seventh community. And with the medical event, we also, the eighth one, we are looking at doing it within the Gushegu Township, which is a big town and highly dense in population. And so we believe that conditions like hepatitis B can easily be spread within these locations because it's highly dense, and these are viruses that are transmissible through even sweat and all of that. So we think that we should have a medical screening there, and then maybe a borehole in one of the areas within the town. And the last but not least is the ninth event, which in my head we are thinking of taking it to a community called Canimo. Canimo is about 25 kilometers away from Patinga, where we had the last event. But it also has an adjoining community called Sukaya. And these two communities are very close to each other. And they are quite big. So we believe that our services will also be much needed there. So these are the 9 locations I have picked. And within the week, I intend to build the projects accordingly. Yeah.
Wonderful. That sounds great, Salam. We got some good options.
Yes, thank you so much, Daniel.
Ben, could you provide us with an update regarding the media house submissions and other media posts?
Yes. So we've finally gotten the drafts ready, the one that we will be sending out to the media houses, which I forwarded to Salam yesterday. But I'm sure because it's weekend, probably tomorrow onwards, he'll be able to forward that out to the media houses. We delayed a bit because we wanted to make sure we include the findings of the test results we had at Patinga into the media coverage so that people would actually know what is happening in these communities. So that edit has been done and it has been added. We've also been putting out a number of social media posts regarding the test results and the reality on ground, because people do not actually believe that communities like that could record such number of positive cases. So we've made a number of posts around that, including the blog post we are sharing. Aside that, I've also been handling the compliance for the 3 different projects we had in Ghana during the trip, and there are some tasks yet to be completed, though we've not had the videos for each of the events yet, but most of the tasks from my end has been completed. I, however, noticed that there are some other tasks which are assigned to Salam and Presido, which they would have to also complete under the project task list for each of the 3 events that we had. So basically that's what I have from my end.
That's wonderful, Ben. Does anyone else have anything else they would like to talk about in the meeting?
So with regards to the media post, I think we can expect it tomorrow or no, by Monday or Tuesday, it should go out. I've already sent it to the media house, but like Ben said, mostly weekends like this, they are not very active. So hopefully it will be out there by Monday. Yeah.
Wonderful. That's great. I look forward to seeing it. Well, if no one has any other questions, that's all I got for today.
Okay. Thank you so much, VP.
All right.
Woo.
Right. Bye, everyone.
Okay.
Good night.
Okay.
Bye, everybody.
Bye.
Bye.
Bye-bye.